Good morning. This is Dr. Thomas Bartel, board certified plastic surgeon specializing in body recontouring procedures. And we're here on this relatively gloomy morning to talk about body recontouring after weight loss. This is becoming an increasing phenomenon due to the fact that there are an increasing number of surgical options for people who need to lose a great deal of weight for their health. I will say, though, that at least half of the patients that I perform these types of procedures on are able to do the weight loss themselves for a variety of techniques that they have, are able to lose 30, 50, 70, even more weight just on their own, which is really very laudable. This is not an easy thing to do. I always tell these folks, who are able to lose the weight on their own, they ought to write a book because they're in rare company. Not everyone can do that. But regardless of how you lose the weight loss, large amounts of weight loss, have significant effects on the body, obviously. The most obvious ones visually are loose skin in certain areas of the body. The common procedures that plastic surgeons have to address loose, sagging skin following weight loss involve the breasts, the abdomen, the arms, the legs, and occasionally even sagging skin in the face and jawline. I'm going to address only 3 out of those 5 because 2 of them are procedures which I do not do, and I'll talk about why I don't do them, but the areas that I commonly address are breasts, abdomen, and arms. Now, it's very, very important that people wait to have any kind of procedure done until they are done losing the weight. Their weight has to be stable. And that's regardless of whether they're having have had a surgical procedure or in the process of losing weight. I always ask them if, when they tell me they've lost 20 pounds and they're almost to their goal, but they're thinking about having something done. I say, fine, we can talk about the procedure, but I'm not going to do it until you are done losing the weight. So it means you either hit your target or you hit the wall and can't go any further. That's the time to do surgery, but not before, because otherwise I'm trying to hit a moving target. So that's very important that you have the timing right. The other things obviously are just like with any kind of cosmetic procedure, other potential health problems. You've got to be healthy. I mean, this is not cardiac surgery. This is not necessary surgery. You need to be at your optimal health in order to undergo any type of cosmetic procedure, particularly smokers. There are certain procedures, and these types of procedures that I do for following weight loss are specifically the types of procedures that I will not perform on smokers. This is not punitive. This is simply because smoking adversely affects scarring and wound healing, and the main drawbacks to any type of surgery following weight loss is the scar, and I want to give you the very best scar possible, and I can't do that with a smoker. So you're going to have to lay off the cigarettes for a good 2-3 months before I'm willing to even contemplate doing surgery on you. So that's that. Now, as I say, the areas that I address are the breasts, the abdomen, and the arms. Now, I don't do any sagging skin on faces because I gave up facial work a long time ago. I gave it up because I didn't enjoy it as much as the body work, and there were other people who did it better than I did, and I can't do cosmetic surgery on anyone if there's someone else around who does a better job. The procedures that I do, I feel I'm the best at. So that's why I gave up the faces. I don't do work on the thighs, sagging thighs. That's a very common problem with weight loss, but even in the best of hands, thigh lifts come with a fairly significant complication rate. I've been to national conferences where the very best and the expert thigh lifters will quote a 33% complication rate. Now, if the very best are getting 1 out of 3 patients have a complication, you're a part-timer like me, who knows what it would be. So I just simply will not do that operation. But what I do is work on the breast lift, abdominoplasty or paniculectomy, sometimes it's called, removing the excess skin around the abdomen and removing the excess skin that hang from your arms. Let's start with the breast. Weight loss will reduce the breast firmness. The breast will tend to sag, and the reason for that is simple. Breasts are largely fat. That's what they are. It's not sexy, but that's what they are. So if you lose weight, a lot of volume is going to be lost here, and they tend to droop a little bit. So what I do is do something called a mastopexy or breast lift, moving everything up. Now this can be done with or without the placement of implants. If you want to have a little more volume, you add an implant at the same time. Can't be a large implant, but you can give it a little bit more oomph. So that's the first part. The second part is the abdominoplasty or paniculectomy, removing the excess skin that hangs from your abdomen. Now, a lot of folks will have had a pregnancy prior to their weight loss, and part of the paniculectomy and abdominoplasty is tightening the foundation to get that nice and firm, because foundations have always been stretched out, just like skin's been stretched out from a pregnancy. So I think that's part and parcel of the operation. Now, tummy tucks or abdominoplasties on patients who have lost weight tend to have the longest scars, because whatever you have that's extra on your tummy, I've got to get around it with my incision. You can't cut the skin without leaving a scar, and that scar tends to be a little bit longer than the ones who just have had a pregnancy and need to get rid of a pouch. The third one we talked about is the arms. A lot of women and men who have had a large amount of weight loss will have this thing hanging on the back of their arm. We call it the wings. Some they call it bat wings or whatever. It just kind of hangs there, and this is removed, similar to an abdominoplasty, just removing the excess skin and subcutaneous tissue. Now, obviously, the downside of any of these procedures is the scar. I can't cut the skin without leaving a scar. Breast lifts tend to have scars around the areola, a short one up and down, and most often a little horizontal scar underneath. Abdominoplasties obviously are across from side to side, and the arm surgery is from essentially your funny bone up to your armpit. Now we try to put the scars in places that theoretically only your closest friends are ever going to see, but a scar is a scar, and it takes a while for scars to mature, to gradually fade and soften. When I say fade, I don't mean disappear. A scar is permanent, but it takes up to 2 years for a scar to fade maximally. At a point of 2 years, basically what you have there is what you're going to have, and we do everything we possibly can to give you the very best scar possible. I usually recommend you get yourself some type of scar preparation, Mederma or silicone sheeting, something that will increase the speed at which the scar fades, but eventually you'll get to the same endpoint. So that's kind of how that works. Now, people will ask me, can you do all of that one time? No. Well, you can, but I won't, because it's not safe. In an outpatient setting, you can only really operate for about 4 hours under general anesthesia to be safe. At that point, the complication rate from the surgery starts to do this, and it's just not safe. And if there's a safer way to do something, that's the way I'm going to do it. So you're going to have to space them out. Now, could you do them all at one time? Sure. If you're in a hospital, and that triples or quadruples the price, and of course they're not going to send you home, they're going to send you to the floor and observe you for 2 or 3 days, and that, that's just, the pricing gets just prohibitive. So what I tell folks is, you decide what bothers you the most. That's the one we do first. Now, how soon can you do the next one is usually the next question that they ask. I say, you've got to let your body recover. So I would prefer it be at least 2 or 3 months to let your body fully recover from the surgery. I've done it sooner than that when there's been some type of a timing issue. They need to get ready for a wedding or something like that. But I prefer to wait as long as possible to let the body recover. So that's kind of how it goes. Now, as I say, there are risks with any surgery, the risks of bleeding, infection, so forth. And that's no different than here. But the main problem with any of these, of course, again, is the scar. And you have to be able to put up with the scar. There's no way to cut the skin without leaving a scar. Skin heals with a scar. Bone heals with a scar. Nerve heals with a scar. Everything heals with a scar. That's the way the system works. Again, the most important point here is wait until your weight has stabilized before you even consider having any type of surgery done. So that's kind of how it works. Liposuction alone, some people ask me, can I do something with liposuction? The problem here is not a fatty problem. You've taken care of the fat problem with weight loss. Here it's just a skin problem. That's the majority of the issue. So that's why, although I will often add some liposuctioning when I do the arms or the abdomen, that's just part of my operation. I do it to give a nicer contour, but that's not the reason I'm doing the liposuction, is to correct the problem. The problem is excess skin, and that's what we do these procedures for. All right, so that's kind of how it works. We should be on next week. I hope everyone will enjoy a wonderful weekend. Try to stay dry, and I'll see you next week.